When children have difficulty communicating and speaking, there is a device that may assist the child meeting their wants and needs non-verbally. Speech pathologist Kyle Meades from the Therapy Group of Tucson is here to tell us about this device. Kyle, thanks so much for coming back.
Hey, thank you, Tina. It's always nice to be here.
We are talking about this specific device. Kind of tell me what it's called or what it's used for.
It's an augmentative communication device. We call it, in the speech world, we just call it an AAC device for short. And it's a computer that helps children speak when they can't get the words out. So sometimes it can take the place of speech or kind of be an adjunct to speech if they're just learning speech, and we do it all the time.
Okay, now I know we have kind of a specific person that has been using it that we kind of want to focus on, and then this will help us explain what it is.
Oh, there's Reggie right there.
Is this Reggie?
Oh, there's Reggie. Yeah, he's a great kid.
Explain his situation.
Yeah, Reggie has a diagnosis of autism, and when his parents brought him to our clinic, he couldn't verbalize his wants and needs, and he couldn't speak, and he had some behaviors. So because of that, we have a speech pathologist on staff. Her name is Silene Hurtado, and what she did was she helped Reggie obtain a device to get him communicating. So when he can't use his words and get those thoughts and needs out verbally, he uses his device. And that's a picture of him there using his device to express his wants and needs, and also to sequence and to match objects and working on prepositions. So it's a really cool way for kids with certain disabilities to communicate.
So this was a success for Reggie.
Absolutely.
And something that definitely helped. So how would somebody, a parent of someone like Reggie, be able to obtain one of these or be able to use one?
Yeah, well, you want to get an evaluation first. Okay. And a lot of children, let's just say with autism, a lot of those kids have there's a scheme in town called the DDD, it's the Division of Developmental Disabilities. They have funds available for children with special needs to get these devices if they qualify. So you have to have a questionnaire answered. The speech pathologist helps answer that questionnaire. They send that information to the state. The state requests that an evaluation take place. There's a team in Phoenix that comes in to Tucson and does that evaluation, and then it takes a few weeks, sometimes a few months to get the device. But once you get the device that fits your child's needs, then we can work on it in the clinic to help that child communicate. So that's how it works.
Now, I know you mentioned autism. Is that normally the child that would use this, or this would be a success for them, or is there many different things that it could be used for?
That's a good question. The different diagnoses that would benefit from a device like this would be autism, also apraxia of speech. Apraxia of speech is when you know what you want to say and you want to get the sounds out of the mouth, but it gets really kind of mumble jumbled, and the kids are very inconsistent in their speech errors. So a lot of those kids with apraxia will use a device like this to kind of get them over that hump and to kind of facilitate that speech. Also, you've seen probably out in the community people with cerebral palsy and electric wheelchairs who have these devices attached to their wheelchairs. Even adults who have ALS or Lou Gehrig's syndrome, there are eye gazes that you can attach to the forehead and scan these computer devices. Wow. Those are very expensive. And also I wanted to mention that these devices don't necessarily have to be a computer. They can be just as simple as what we call PEX cards, which are cut and paste in a picture card where kids can point and get what they want. And then they can be as high up and integrated as a computer system in a hospital room. So there are so many different degrees of AAC devices out there. This is just an example of what we do.
And is this everything from basic things like what I want to drink all the way to more complex things that they could be
medication management, you know, or just wants and needs in the community? If a child can't say it, or the adult or the patient can't say what they want, they'll adjunct that speech and touch the device or show the person for whom they're communicating with what they want.
Now, I know we were talking about the kind of the more expensive, the eye scan ones, but the ones kind of like what we're looking with Reggie and that kind of level, does insurance cover something like that?
It can, right, and that's why I was mentioning the DDD. It's a form of Altex, which is Arizona Long-Term Care. They do have funds for people who qualify, so there's a qualification process.
So the first thing to do, of course, if somebody's starting from square one, is to come in and talk to you guys, have you, like you said, do an assessment for the child and see kind of where we're at and go from there and see if this may be the end game.
Right, because if you go out and buy an iPad and load some apps on it, I mean, sometimes it won't work and you just wasted that money. So you want to make sure you're getting the right device and the right program.
And the right diagnosis, like you were saying
Absolutely,
before.
and that's what we do.
So this is exactly, as I always say, Kyle, why you come on here, because I know that there's a parent at home that's struggling or is dealing with this and doesn't know where to turn or what could be a possible result, and that's why you come on. So thank you so much again.
Thank you for having me.
Now, if you are in need of a speech or occupational therapy services, call Therapy Group of Tucson. They're at 232-2021, or for more information, log on to supportvoice.com.